Welcome to the Atlantum Alliance Villa and the Global Health Stratologues. I'm your host, Louisa Swergon. Today's episode focuses on one of the most ambitious healthcare platforms emerging anywhere in the world, the Global Health Exhibition in Riyadh. Over the past few years, the exhibition has evolved far beyond a traditional trade show. The scale itself is remarkable. The 2025 edition brought together more than 130,000 attendees, over 2,200 brands, and generated an estimated $35.5 billion in deals, positioning the platform as one of the largest and fastest growing healthcare gatherings globally. Joining us today is Sunita Khatri, the show director of Global Health Exhibition and AVP of Tahaluf. Sunita, welcome to the Global Health Stratologue.
Pleasure to be here.
So, you've just delivered what many people are saying is one of the most ambitious editions of GHE to date. How do you describe what the platform has become?
I think Global Health Exhibition has really evolved from a traditional healthcare event, which probably in most cases is a marketplace where people come source supplies. But I feel in the past two editions, it's turned into something which is more of a convening platform where we have policymakers, we have innovation, we have investors, and clinical leadership that's coming into the play. Things have really changed from that perspective from a traditional event. One of the few events in the healthcare space that really brings in the ROI. Tangible outcomes is probably the biggest benefit of the event, and I think that really contributed in escalating or elevating the show to a bigger level this year.
And so what point did GHE shift from being a regional exhibition to a global healthcare convening?
Yeah, I think we saw a big change in the last year's edition. Healthcare leaders and CEOs coming to the country. I think the potential of the market was something that was very clear to them, and the opportunities of actually meeting with the government stakeholders. That definitely elevated the profile of the event itself, because when you have global healthcare leaders coming into any event, it puts that into an international and global perspective.
And on an operational side, how do you deliver a show with that level of growth?
That is actually, I think, quite a bit of a challenge for any event organizer. When you're scaling the event to that level, it needs to match up in terms of the expectations of the attendees as well. I think our partnership with our government stakeholders, specifically the Ministry of Health, has been really critical to the success of the event. I think the vision is very clear in terms of what they want to achieve from an industry as well as Saudi Arabia perspective. And I'm happy that Global Health is used as that platform to bring in the right kind of people, and it's aligned with their long-term goals as well.
And why is Saudi Arabia becoming one of the most important healthcare markets globally right now?
Saudi Arabia is going through a huge healthcare transformation, and what is really impactful is that, of course, the vision and the goals are there, but it's also the scale of investment into the projects itself, which is massive, which is really huge. And there are priorities when it comes to healthcare, and it's not just limited to a public service, but it means an economic diversification, it's localization, it's developing the workforce. All of these are the key objectives when it comes to the Vision 2030. And also keeping in mind that it is a country which has got a big growing population, which means that healthcare needs are going to be urgently needed. And the transformation right now is extremely important for them to actually make sure that this is actually achieved in the next few years. And it's happening already at scale. I think these factors are really critical for the country. Yeah,
definitely. Everyone needs healthcare, don't they? So
absolutely, yes.
You have to be able to scale with the population. And what do you think international players are still underestimating about the Saudi opportunity?
There seems to be an outdated view that it's all about procurement, and it's all about infrastructure, but that has really evolved. It's now a lot about investments. There's a lot of partnerships that come into play here. There's a lot of private sector partnerships that are having in the country. There's a lot of opportunity for startups to come and set up businesses or try to expand into Saudi Arabia. I think that is really changing, and I guess that needs to come out a little bit more. And I guess platforms like Global Health Exhibition really help elevate that. But there's obviously kind of like an expectation from international companies as well when they come to the region that it's a face-to-face interaction. It is getting to know the companies, getting to know the people, the culture. I think that is a really important aspect of doing business in Saudi Arabia or any country for that matter. It's not just about business. And I think the perception is changing, it's evolving. To give you some context, last year we had 20 international pavilions that came to the event, which is a huge increase from previous editions. So things are opening up, and I guess Saudi Arabia is coming into everyone's knowledge and perspectives.
What does the government backing let you do that private exhibitions you wouldn't be able to achieve it?
There's always a benefit when you have a government partner that is working with you strongly. There's obviously going to be a far better pull when it comes to participation. The whole healthcare community is coming to the region because you have the entire government ecosystem coming into the play. So that team, when that comes together, it just makes a solid event in every perspective. So it's very critical part of it. And I think that sometimes could be harder from a private event perspective, where that decision-making force may not be part of it.
Yeah, and that enables you to act as a policy and investment bridge and not just the platform.
Correct, exactly, yes.
So after a record-breaking 2025, how do you raise the bar in 2026? Where do you go from here?
We have a lot of new plans for the show this year. We are expanding into new sectors, specialized sectors around orthopedic and rehab. We are going into dental, aesthetics and dermatology, as well as wellness and longevity. The focus is to go into more specialized streams, as well as also keeping in mind that preventative care is extremely critical part of it. Wellness and longevity is actually a very important focus for us this year. Also from experience perspective as well, what we will get to see at the show is a lot more interactive formats, upscaling the kind of curated matchmaking and the investor programs that we have at the show. The whole idea is to bring in a lot more communities into the play and not just focus on the scale or making it bigger, but making it more focused as well as more outcome driven this year. So I hope we're able to bring that more into the picture.
Yeah, I think that sounds great. So what does it take personally to deliver a show of this magnitude?
It's a lot of blood, sweat, and tears. We have, considering the scale of the event, a team is quite tight. It takes us a year to actually put an event together at this scale, working with a lot of different entities internationally as well as locally. I think we've reached a point where I feel that, yes, scale is important, but it needs to be measurable outcome for the people. Global Health Exhibition is one of the few events which brings in policymakers locally as well as internationally into one room. So there are ministerial level discussions that are happening last year especially, and very few events actually are at that level where we have policymakers in one space. So I think that is extremely critical to have a global convening platform around that, and of course an impact around the outcomes as well.
Yes. What are you most proud of from?
I'm definitely very proud of scaling the event to this level where we have a global recognition. I think we are quite well known in Saudi Arabia, but like I said, globally as well, a lot of people have been talking and knowing about the event. And of course, I'm very proud of my team and the effort put in by all the team members to have this one vision and goal to make the show successful.
Yes, yes. And has there been any real challenging moments, anything you guys have had to overcome?
There's so many of them.
Pick one.
When you're bringing in so many international ministers and speakers into the play, you obviously have to, the stakes are quite high in terms of the experience at the show, how they come in, the way when they enter into the event, the feeling and the experience that they have at the show. That is obviously, I wouldn't say a challenge, but it's something that we would like to make it even better every year.
Will exhibitions like GHE still exist in the same format in 10 years, do you think?
I think the relevance of events and exhibitions is still going to be there in 10 years for sure, because You can't compensate meeting a person personally at an event. That face-to-face interaction is always going to be very critical to the success of any business for that matter. And platforms like Global Health Exhibition make that happen. Having said that, what was really going to evolve, and I see that already that's happening, is integrating technology into everything that we do. The platforms that we use when it comes to the mobile apps that we're using, or the registration that happens, or the experience at the show is very much technologically driven, including AI into everything that we do, from the website to the different platforms that we're offering as well. So that's definitely going to evolve a lot more, definitely in the future. And and who knows what's going to happen in 10 years.
I know. So when you look back on 10 years ago, but as you say, I think these spaces with bringing people together can't be replicated online.
Correct, yes.
So what role will data, AI and preventative health play in shaping future editions?
It's instrumental to the event. It's instrumental now, actually. And what is fascinating to see from a government perspective is that it's not a vision for the future. It is now, which is implementing at scale. And I see that there is an increasing focus in digital innovation, not just what you see when it comes to on-site, where you see technologies, but also implementation across the various hospital infrastructure and government infrastructure as well.
So I know we just spoke about 10 years being crazy. So let's bring it back a little bit. So if we fast forward to 2030, what do you want Global Health Exhibition to represent globally?
I want it to be an event that you cannot afford to miss, for sure. Definitely evolving into a bigger event, but also making sure that it's impactful in every way from every attendee perspective. There's a lot of focus on deals. There's a lot of focus on actual investments happening in the space, because if that does not happen, it's not ever going to grow into a big event. It's not going to evolve. It may cease to exist if there's no business coming out of it. So those aspects are really critical, to have measurable outcomes, to have tangible benefits coming out of the event. So the focus is definitely going to be around making that happen, definitely from a Saudi Arabia perspective, but also from a regional Middle East, North Africa perspective as well.
Sunita, it was a pleasure talking to you.
Thank you so much. Pleasure being here. Thank you.
Thank you.